Okay, today's class is on effect of posture as it is given in your competencies, that means in your syllabus. The syllabus is divided into competencies. Already one internal assessment is over, you should know this. As it is given in one of your CVS competencies, effect of pulse and blood pressure at rest and in change of posture and in muscular exercise. This is the, if I think one or two words may be misplaced, but this is the theme of that particular, I think PY 5.5, not 0.5, PY 5.7 or something like that. Okay. Why I am not saying not point is a mathematical term. 5.1 and 5.10 mean the same thing. So here I say 5.1, 5.1, it is up to 5.12 like that for CBS. So mathematically point is 5.1 and 5.10 is the same thing. So I say 5 dot, PY 5.1, 5.7 or like that I think. Effect of demonstrate pulse and blood pressure at rest and in changes of posture and muscular exercise. This is that particular competency. So we have done at rest. Although your performance is not that good. We have done one class on arterial pulse at rest, one class on blood pressure, measurement of blood pressure at rest. But usually or ideally the sequence should be, we should first study general physical examination, just introduction to clinical physiology, general physical examination, which is again one of the competencies in some general, then we proceed to systemic clinical examination, and there in general physical examination there are certain points to note. Ideally or in the clinical, in the words we should note from, in the practical circumstances we should note from head to toe. Like pallor for anemia, or say a person is anemic. So the point to note is pallor. The person is becoming pale due to the person's face. So where do we note them? We note them in the tongue, in the eyes and other areas, nail beds. So practically what happens in the clinical scenario, when we actually see a subject or see a patient, he will not feel very good if I say once, okay, you take out your tongue like this, then I just note pallor, so I write about pallor. Then after some time I say again take out your tongue, and now let me see the underside of your tongue. There I see jaundice, whether yellowish discoloration. Those are the common sites for seeing. So what we see is head to toe. When I'll see the tongue, I'll see everything. When I note the head, face region, tongue, I'll note everything. Then I'll go to the body. So this is but for beginners, we use certain points in general physical examination for beginners to learn that these points should be noted. So for beginners, we go by points. So first point to note, say, is the build of the person. First point to note is the build of the person. What is the muscularity and all, as soon as he or she enters. So this class will be on next Thursday. That was I'm telling you now that this class, general physical examination, we'll try to do it next Thursday, and you will get only one day because you have to go on with the syllabus. For the other batches, it will be Tuesday, Friday, Wednesday, Saturday. One day is actually one day. Why it is even 10 days is not enough if you don't practice at home. Pulse and blood pressure, whatever we learned in one class, you have to do that at home. I am saying that those who are poor. So you have to practice. Blood pressure, even if not possible, I don't have the sphygmomanometer with me at home, but pulse is possible. You have to do clinical examination where instruments are not needed. You have to practice by yourself. Otherwise, it will be not enough. There was no use doing DLC for 1 month in my opinion, but HODs has insisted that no, they will learn, they should learn well and all, but rather total count of RBC, WBC for the last batch we did for say like 20 days, 3 weeks or so. But DLC for 1 month, it is good, but if we have time, if we have a 1.5 years course on anatomy, physiology, biochemistry like we had earlier, then it is possible. In 9-10 months, so we have to go on with the syllabus. I think general physical examination we will get only one class for now. If we can revise later, we'll see. then practice among yourselves. This does not need instruments. Pulse and blood pressure, measurement of arterial pulse and measurement of blood pressure are two of the points in general physical examination. Pallor, cyanosis, jaundice, clubbing, edema. First is build, okay, build and nutrition, general build of the person. Just by looking at the person you can get an idea. So these are four broad headings where there are four broad headings under which we examine a person. Those broad headings are not these points. What clinical points to note, not those points. What are the four broad headings? Four English terms: inspection, palpation, percussion and auscultation. The board is not ready right now like that, so I will not write, and this is the next class actually, but inspection, that is the class on general physical examination. I am just saying the words. If you have a book right now, you may consult, and please try to carry one practical book. I told for the hematology lab also, and this is a very light book, and even if you have to carry CL Ghai, no problem. And CL Ghai, I will recommend the time left. For the hematology part, I told read from CL Ghai, read from AK Jain, and then consult CL Ghai for the questions. From now on, at least I would recommend read CL Ghai. Very good book. And Physio Ghai actually a very good book, but for the hematology portion, I told, as it is a colorful book and all, read AK Jain. From now on, you may study CL Ghai. You may read any book, but you may take lend the CL Ghai from the library if you don't have, and read from that directly the topics, because time is very short. I think by the end of August or by the middle of September, you will appearing for the prof exam. So by July, 2 more internal assessments. By July end, 2 more internal assessments, and by August end or September, if it is in September, then I think Dean sir will arrange for the exam in early August. But the target should be by the end of July. Okay, by the end of July. So just 6 months for the whole syllabus, the remaining part of the syllabus, and only very small part is done. For your last batch, classes started on October 4, and we did the foundation course, not like that 1 month foundation course. So but NMC is recommending to spend the first time for foundation course. But for the last batch, we did the foundation courses classes just in between. Sometimes cancelling some class and doing some foundation course like that. We did not do it like 1 month foundation course. So classes exactly started on October 4 for the last batch, and exams were taken on, I think, August 1st of August. So this time it may be maximum 1st of September by the university, or maybe the first week of September. But you consider it as middle of August theory. Last time by 15th August theory was over. Okay, you count it as 6 months from now on. Just keep it in your head, it is 6 months. Now in 6 months you have to do so many things. So same class repeating it will not be possible. Still we will try to do the respiratory system, cardiovascular system, whatever is left, except pulse and blood pressure is a part of general examination as well as of the cardiovascular systemic examination. So we divide it for convenience. Even we divide these subjects for convenience. Okay, CNS, there will be so many things which are almost, that means you have to run the tracks from the anatomy. Here also, if you don't know about the arteries and veins location, how will you study about the baroreceptors? Location of baroreceptors is at the carotid sinus, aortic arch. So you should know about the aortic arch and about the carotid sinus from the anatomy knowledge. So everything is interrelated, everything is, this division is just for knowledge. Even there are examples where physiology, that means specialists in physiologists are helping to write anatomy books, they are writing physiology books, just they are contributing by their knowledge. So knowledge is overall, but we divide for just convenience of gathering that knowledge. So pulse and blood pressure like that are points in general physical examination. If you are asked as beginners in physiology, examiners will ask, tell me the points under which general physical examination. So that is then I am telling the class for next Saturday. So pallor, cyanosis, jaundice, clubbing, edema, pulse, blood pressure, respiration, temperature, no need to write, just go and consult a book before coming to the next class. If possible, consult it today, your textbook. So neck veins, neck glands, these are the points to be noted in general physical examination. Usually first we do that class, and then sequence of classes is next we move on to some systemic examination like respiratory or CVS. This time we have done the classes, say general physical examination, 2 points have been done, pulse and blood pressure. Today we are doing that, we have done at rest. Now what will happen in change of posture in exercise? As you have done regulation of blood pressure and all theory, I hope you know. That means Owen sir has taken the class that regulation of blood pressure. I think regulation of cardiac output, heart rate has also been done. If not, it will be done. Heart rate, cardiac output, blood pressure is the same competency. Same competency, regulation of heart rate, cardiac output, blood pressure and regulation. PY 5.6 and PY 5.7 is probably, or it may be PY 5.1, 5.10 or 5.12 like that. That what is to be done in the practical class. This is a DOAP session, demonstration, observation, assistance and performance. This is the full form of DOAP. DOAP session, the theory session, lecture session, regulation of blood pressure, this cardiac output, heart rate in the same competency. It will be done. Shock, you have to study what is shock, regional circulation, coronary circulation, these parts are left in CVS. Usually before the first internal assessment, whole of CVS, whole of hematology is done. Hematology, immunity is left, WBC, immunity and blood group you have done in the practical class, but blood groups and hazards of blood transfusion, blood group and blood transfusion one competency. That theoretical part is left. So I think next Wednesday will be the first class on WBCs in the theoretical part, next Wednesday. And then Monday onwards. Next Monday is a holiday. Tuesday we will take the CVS class, and HOD sir will continue with nerve muscle physiology from the Tuesday after that Tuesday. Okay, next class Tuesday will be taken by Owen sir for CVS, and Wednesday hematology by Shubha sir. That is according to our convenience and all. That is not your headache. So next class will be next hematology class, theory class will be on WBC. And then immunity, which will take say 3 or 4 classes, and blood group, blood transfusion 1 class. So effect of posture, I think you know that when a person stands, what happens? Venous return decreases. That is more prominent. If he is standing for a long time, the body will try to physiologically adapt to it. But if from certainly if suddenly from supine, so it is recommended when you get up from bed in the early morning, don't rush. If the class is at 9 AM, don't get up at 8:30. So just first from supine to sitting. We all do this at some points in our life if we are indisciplined. The other 2 batches will be getting general physical examination 2 classes. So think if it is ideally 2 classes, then one class একটা ক্লাসে হয়তো 30 মিনিট 40 মিনিট এখানে হবে, বাকিটা পুরোটাই ওই ক্লাসের বাকিটা আর পরের ক্লাসটা পুরোটাই বেড সাইডে হবে। and it is interesting also. lectures তো বোরিং সবাই জানে, যদি না সেটাকে ইন্টারেস্টিং করা যায়। অনেক লেকচার, ফিজিওলজি শুড বি ইন্টারেস্টিং বিকজ মোস্ট ফিজিওলজি লেকচার্স, কেননা মুখস্থের অংশ খুব কম। এন্ডোক্রিন ইজ somewhat a bit of a this memorizing, but still how the endocrine system is working, at least the introduction of the endocrine system, there is some most things to understand. Most things in physiology are not memorizing, so except names like Frank Starling's law. If you ask the faculty why it is Frank Starling's law and not in my name, that is a stupid question. So it is according to Frank Starling's, and you have to know Frank Starling's law is done, I think. So that type of name after the names of the scientists. So change in posture, you wake up, just sit for some time and then get up from the bed, because even on sitting, some due to gravity, some blood is redistributed to the splanchnic arteries and veins. Splanchnic circulation, that is abdominal. Then when just as you get up, it is going to the inferior extremities more. Venous return is decreasing, that is also due to gravity, and cardiac output and blood pressure will fall. And how this is coped up, that has been done, regulation of blood pressure baroreceptors. How this is coped up, how they are inhibiting the vasomotor center, or wherever, when they are inhibiting, when they are exciting the vasomotor centers in the brain. This was the class on regulation of blood pressure, which has already been done. So that is what is happening in change of posture. Although gravity is not mentioned directly as a part of your syllabus, say gravity and posture are interrelated. If I pick the hand up and if I do not keep the sphygmomanometer at the level of the heart, then each centimeter, for each centimeter it is changing by 0.77 millimeter of mercury. So in a say at the foot, say it is 100 centimeter away from the heart, so it's 100 into 0.77. That change, that is 77 millimeter. That as so, but that such changes actually are not affected because of the physiological mechanisms. Now, if in old age, say physiological mechanisms have deteriorated, so in old age the person is no more as strong, teeth are not as strong as in young age. Okay, so even Colgate won't work. So if the physiologically and anatomically the body parts have deteriorated, how will so Colgate is like a medicine only, so it will not work. Okay, so people will tell I am advertising a particular brand, so this part should be edited. So toothpaste will not work. So whatever medicines to have a capacity. So physiological capacity, when it is overcome, then we try to that means adjust it with medicines. We try to improve it with medicines. But once in life, if we get a 160 by 90 blood pressure, I will not 160 by 100. I will not having the person to continue for. Say a person has come running to the chamber that this doctor is very strict. Instead of 5, if I go there at 5:15, he will run away to another chamber. So I must reach by 5, and he has come running. I measure the blood pressure and say, okay, you take this medicine from now on. So that is not the way. So first we have to determine why that is more. So all these will be there, you will learn in medicine. But just the basics, effect of change in posture, 0.77 millimeter of mercury per change in centimeter above or below the heart. That means increase or that means increase in how many that length above or below the heart. This is gravity. Posture is from sitting to. So what we do in the practical, we will do just now. Just measure and don't even untie the cuff. Just in these types of these things you have no way. We just keep the cuff over there. And in those today there's battery operated which can be used by the layman also, because the reading is automatic. Okay, so there you should do, you just detach it from the actual where you are getting the display and all, that part you just detach it. So after the person, because what will happen if you waste time, even the body will try to recover in maybe in us, in you, even in me. I am not that old, so I am just around 40, so not that old. I am not 70. So in people, physiological mechanisms will recover it it will try in few seconds, 15 seconds maximum. If 3 minutes there is a, if it is for 2-3 minutes, that is what happens in old age. If for 2-3 minutes the BP is so low, then the effects will appear. So in 15 seconds, 20 seconds, the body will try to recover. What you do, you just measure in supine position, and from the examination point of view, when the examiner asks, you show me what happens to blood pressure in change of posture, you measure, just detach the cuff, but don't untie the cuff. They make the person stand, again measure, and immediately, as fast as possible, suddenly stand, you measure. If you know that the subject has already history of a disease, then this experiment means I am telling during the exam, it should not be carried out. So I already have a disease, so immediately if I try to do that, something wrong may occur. Like someone got yesterday also, someone got ill during the exam. So if there is a history of your clotting disorder, actually you should report that I have some actual medical illness. So we will not ask him or her to do bleeding time and clotting time in the physiology lab. Okay, we will not ask him or her to prick the finger. The examiner may instruct, the external examiner may come and instruct us that okay, blood will not be supplied to them, they have to prick their own finger and do the experiments. But if someone has an actual history of a medical disorder, then we will request the external examiner. Obviously, he or she would also listen to it, because we will not want that someone falls actually, someone has to be taken to the hospital in the middle of the exam. So for him or her it may be allowed, okay, but not for others. So we will not do that for known persons, any person who has a known medical history, but in general we will be doing that. So immediately stand and measure. And for effect in exercise, we have certain experiments also, like hand grip dynamometer and all. Last batch it was done, but we don't have the Harvard mechanism, this infrastructure to do the Hubbard step test. That is also mentioned. So Hubbard step test we do not do here, but different levels of exercise: mild exercise, moderate exercise, severe exercise. And exercise muscular physiology has not been still done. There are two types of exercises according to the length of the muscle. Isotonic exercise, where the length of the muscle changes, muscle fiber changes, actually work is done. Most examples where muscle is voluntary muscle work, okay, running, jogging, etc. If I try to push a wall like this, will I do any work? Will I be able to? If I just push the wall like this, will I be able to move the wall? So actual muscle shortening is not occurring. That is isometric exercise. So what is the change in isotonic exercise, isometric exercise? Actually, exercise physiology is again another separate in standard textbooks. It is writing 100 pages on exercise physiology only. So what are the changes in BP and blood pressure in exercise? In isotonic exercise, diastolic blood pressure usually does not change, or it may fall. Like when I am running, what is happening? There is vasodilatation locally in the exercising, near the exercising muscles, so at the exercising muscles. So actually diastolic blood pressure may fall, but systolic blood pressure will definitely rise within a few minutes. If it is mild, it will be a mild rise. Heart rate also it will rise, but diastolic blood pressure may fall. In isometric exercise, I am just trying to go on and push the wall. So once one cause is due to stress also, both systolic and diastolic BP will rise, my pulse rate will rise and all. So heart rate will increase. Increase in heart rate will still sustain for some time. Increase in BP, the body will try to first control the blood pressure. So that will not be very sustaining for a very long time. So 10-15 seconds maybe maximum. Even after 2 minutes you will get normal. Even after 1 minute you will get normal. So you do it immediately. So this is change in posture, change in exercise. And exercise, isotonic, what happens in isotonic, what happens in isometric. Here during demonstrating, obviously some jogging or hand grip dynamometer, that will be a separate class if we get time. If we do not get time, then there is no question of providing it in the exam, and we will not give you in the auspice also if it is in our hands. But if the external examiner, usually they do not do, usually, but I am giving just not a warning, but this is just a reminder to you, or just telling you, if the external examiner wants to set the auspice himself, here we try to take these 3 exams, acquaint you with the auspice, this what type of objective structured questions will be there. Even we try to take one class on these or some sample auspice, you prepare like that, or you just know the topics like that. But if the external examiner wants to set auspice himself or herself, then we cannot do anything about it from here, and there may be a question on Hubbard steps test. So theoretically we will discuss with you, but we will not give it to you. And human physiology nowadays we include it with the auspice only. In the first batch we even asked to work with the hand grip dynamometer. So don't worry about that right now, we will see what happens by the end of July. But for today we will do this effect of posture, gravity, and this is a single, obviously most classes will be single classes. It's up to 1 PM, 1 hour 15 minutes left, more than 1 hour left. Okay, you may leave at 10 minutes before, but 1 hour you do this thing, and you do at rest also, practice, because your exam general performance was not very good. So we'll do that in the lab over here. Lab means this clinical room over here. Supine থেকে স্ট্যান্ডিং করে দুবার দেখতে, অ্যাটলিস্ট সুপাইন থেকে স্ট্যান্ডিংটা দেখো, সুপাইন থেকে সিটিং অতটা পাবেও না, মানে তোমার কিন্তু অ্যালাউড নয় এটা করা, এই যে দিস ইজ নট অ্যালাউড, ক্লিনিশিয়ান সিটিং অন দ্য পেশেন্টস বেড। ব্লাড প্রেশারে যদি সিটিং পজিশনে, যখন এমনি আমরা অ্যাট রেস্ট ব্লাড প্রেশার সিটিং পজিশনে দেখি, তার নিয়ম জানো? ফিট শুড টাচ দ্য গ্রাউন্ড, পা হাওয়ায় ঝুলবে না। এবার সেগুলো সব কিছুরই কারণ আছে। এমনি যদি সুপাইন থেকে সিটিংয়ে দেখছো, হি উইল জাস্ট সিট অন দ্য বেড, পা বেডের ওপরেই থাকবে, সেই অবস্থাতেই দেখবে। আর পশ্চার হয়ে গেলে এক্সারসাইজ করো, অ্যাট রেস্ট দেখে নেওয়ার পর সে 5 মিনিট জগিং করবে, কোনো অসুবিধা নেই। এই ফ্লোরের উপরে জগিং করলে কিছু অসুবিধা হবে না, দৌড়িও না, পড়ে যেতে পারো। জগিং করে তারপর দেখো 5 মিনিটস জগিং, দেন সি। বা একজন ওর রেস্টের প্রেশার দেখেছো, তবেই তো জগিং এর পর আবার দেখতে পারবে। সেগুলো একটা নিজেদের নোটবুকে লেখো, তাহলে তো মেলাতে পারবে। আর আবার যেই জগিং হয়ে যাবে মেজার করবে, কেননা আবার 5 মিনিট পরে করলে কিন্তু আবার সেটা ফিজিওলজিক্যাল কম্পেনসেশন হয়ে যাবে। আর যতদিন অন্তত ফার্স্ট ইয়ারে আছো ততদিন ইউ ট্রাই টু ডু উইথ দিস ফিগমোম্যানোমিটার্স, নট দ্য ডিজিটাল ওয়ান্স, মানে ব্যাটারি অপারেটেড ওয়ান্স, তাহলে কিন্তু শিখতে পারবে না। ওগুলো তো জাস্ট, ওটা তো লেমেনরাও পারে। হোয়াট ইউ হ্যাভ টু ডু ইজ উইথ দিস ওয়ান্স, যেখানে তোমাকে অ্যাকচুয়াল মেথডটা তোমাকে ম্যানুয়ালি করতে হচ্ছে, দ্যাট ইজ হোয়াট ইউ আর লার্নিং।